Hi, everyone. It's Cheryl Koehn from Arthritis Consumer Experts, and I get to say Happy New Year. Hopefully 2021 is going to be a much improved, much improved version on 2020, and we couldn't be happier to start our Arthritis at Home programming off with a really good friend of mine, an arthritis advocate as well, Billie Murphy. Billie Murphy is in my books, a superstar. She is a graduate of the American Musical and Dramatic Academy in New York, and she's the school director at Vancouver Westside for Lights Up Musical Theatre Schools, which is BC's premier theater program. And she spends her days with kids of all ages, teaching them really not only theater fundamentals, Billie, but you're actually giving them a path in life as well. Welcome to the program, Billie. What we're here to talk to you about, as you know, and I'll share with our audience, is osteoarthritis of the hip. And specifically from a young person's perspective. It's often thought by the public, as you know, that osteoarthritis in any joint, let alone the hip or the knee, is an old person's disease. And you're here in part today, not only to share your experience in undergoing a hip replacement, Billie, but also to shed some light on what that's like for someone who is young. How and when did your hip osteoarthritis begin? And I realize it may not have begun in your mind or medically, clinically as hip osteoarthritis.
Yeah, so it probably began like when I was 10. I danced a lot growing up and I ran a lot and didn't know that I have hip dysplasia. So that means that the socket doesn't fully cover the ball. So there's less support for your hip. And I also have a hypermobility disorder. So those two things together, there wasn't much holding together my hip joints, despite all the
Like a
activity.
rubber band woman running along.
Yeah, it was just desperately holding on. So in 2014, I tore my left labrum.
Yeah.
And it took a long time to diagnose that. It took about 9 months to get the left labrum even diagnosed. And so when it was diagnosed and we decided to do surgery, the surgeon said he thought the surgery would go well, but there was already some arthritis in the hip.
Right.
So that's when I first learned that I had arthritis. And then subsequently I had my right labrum repaired quite a few times, didn't really work. And again,
That's an understatement. Yeah.
I was told I had mild arthritis in that hip as well. But then when I actually had the hip replacement done and they went in there, and this is quite common, the arthritis was much worse than what the scans showed.
Yeah. And for our audience, Billie, the things you're talking about, the labrum, will include a diagram at the end of our talk here that sort of shows some of these components of the hip joint that you're talking about. And so basically through all of this, because of your hip dysplasia, you were undergoing through your activities injuries, micro and major, within the joint, which set you up, for lack of a better way of putting it, really set you up to develop osteoarthritis. So you finally got multiple diagnoses about what was going on within your hips. I want to talk to you about your voice in the healthcare system, because once you get to a doctor, a qualified surgeon, most of them are very, very good. You get the surgery, you have a very intense period where you do the rehab. People are fine. It's getting there. It's that road leading up to surgery. So tell us about how you think you had to use your voice, Billie, and what you might offer as pearls to our audience.
But I think especially for young people and people who don't fit into the normal box of joint problems, there's no real clear pathway for your GP or anyone to refer you on if there's a problem. So I mean, even before my diagnosed labral tear, my physio was very sure I had hip dysplasia. But my doctor didn't really know what to do with that. So I think kind of doing your research and going to your doctor and saying, everything points to this, and I've looked up these physicians. Is there any way for us to refer me? I think would be the way to do it. It's not necessarily the way I did it, but it would be the way to do it.
I'll say to our audience, be very selective and know that you're going to really good resources. Our own website, jointhealth.org, arthritisresearchcanada.ca or arthritisresearch.ca, arthritis.ca, which is the arthritis societies. Those are places that you can go for really good, credible information. And Billie, I know you're going to share some resources with us as well at the end, specifically related to hip dysplasia and your particular entry point into the disease.
Yeah, and I would also say, if you are feeling something, to believe yourself. I think, there is, don't Google things and decide you have the worst case scenario, but if you are experiencing something, and it can feel, especially if you're going to health practitioners who don't exactly know what to do with you, they can sort of put you down sometimes, and that can really mess with your brain. So if just your body more than anyone else. I knew I had worse arthritis than the scans were showing. So just really listen to your body. And
that's such good advice, Billie, because a lot of people struggle, Billie, with this first part of their journey, as you and I have discussed before. How did you make the decision to go ahead as a young person to get a joint replacement? Because again, another myth is, I have to wait till I'm old because they don't last long. Well, in actual fact, hip replacements can last 25 years today. Yeah. So why wait 25 years in pain to get it just because you've reached a certain age? So just explain how you did that for yourself.
So like I said, I have a really great physio, and she saw this, I think, writing on the wall way before I did. So I think, looking back, she was gently sort of guiding me towards this inevitability for quite a few years, actually. And it was her who just finally said, I think we need to write a letter to your surgeon and say that you would like to consider a hip replacement. And so that kind of just helped me come to terms with it. Yeah. And she's always been really supportive, and I really trust her. So I knew that even though all these other things weren't working, I mean, if you take the hip out and put a new one in, it's probably going to work a bit better. So having her support really helped. And then just reading about hip replacements as much as I could. I really researched young people who had hip replacements, and that was really helpful. And actually,
that led you to where you got your hip replacement, which was not in Canada. You actually went to France. You did fundraising. You had your community support you. Your journey is just incredible. So you went to France to someone who actually did this operation in people your age quite commonly.
Yeah, he's actually the surgeon for the Paris Opera Ballet.
Okay.
So there's a lot of tired hips in relatively young people there. So I went to him, and he did an anterior hip replacement, which means they go in the front instead of the side.
Right.
And it was also a custom hip replacement. So he did a CT scan, and they made an exact match to my anatomy and my hip.
So rehabbing, how was it?
It was pretty good, actually. Because I'd had so many hip surgeries before, I was really familiar with how you rehab. Yeah. And I think my body actually was just used to rehabbing a hip. It kind of knew what to do, because it had done it so many times before. And in some ways, because you can, once it's, you know, not too painful, you can stand on a replacement joint sooner than if they're repairing soft tissue. So in some ways it was a bit easier.
Yeah, and the hip as opposed to the knee, it's a super protected joint. I mean, there's a socket and a ball. So the engineering of it is not ultra complex. And the reason for our audience's benefit, Billie, for going through the front is because the pain post-surgery is apparently less. The recovery process or the rehab process, if done correctly, as I know you did it to the letter because you're a disciplined dancer by training, is a bit shorter, I understand. But it is important for our audience to know that when you look at research of the anterior approach and the approach from the side, outcomes are the same long-term, short and long-term. So post 1 year, it's that first few months that is quite different as an experience post-surgery. When you think about all the things you had to give up, and I know riding your bike on the road was one of them, before you had your hip replaced, how many of those things now are back in your life? Let's talk about all the happy things that happen after a joint replacement, such as a hip replacement.
Yeah, so, well, obviously I'm riding my bike again because I ride it with you.
Yes.
So that's a huge thing. And just the social aspect of that, being able to do activities with other people, that's huge. Walking, I couldn't really walk.
Wow.
My hip replacement, actually a cane. That I kind of refused.
Is that your medical assessment?
Yeah. Yeah. So walking, that's nice to be able to do. And just day-to-day things are a lot more comfortable.
So this must have really impacted your work. If you're working with children and you're supposed to be teaching them about dance and musical theater, your body is part of your work toolkit.
Yeah.
How did you deal with that?
I mean, it was hard because I had to kind of give up the dance teaching aspect of it, which at the time was a huge part of what I did. But it also, in some ways, it made me a smarter teacher, I think, because I couldn't just do the thing to show. I had to figure out ways to explain it or just other ways to teach it. So it wasn't very fun, but I think I did learn some things from it. I mean, even just in everyday life, I think you learn a lot from not being able to do things the way other people can.
Exactly. It's the art of modification, I call it. You know, when you look back, just overall on your journey leading up to your hip replacement, and all that you experienced, what would you do differently? What would you just overall, and what would you share with our audience about what you would do differently or what you would do the same?
Yeah, I think kind of on a personal, more just general level, I would tell more people. I didn't really tell a lot of people what was going on. So I would tell more people because people can help you, and you never know, like yourself, what other people are going through. If you are going to see a doctor, write down ahead of time what you're going to say to them, your questions. I would keep a pain diary. I didn't do that. I would do that. I do that now, and I find it's really helpful.
That's great advice, a pain diary. So basically just talking about when it happens, how long it lasts, what you were doing, just sort of the basics about the pain experience.
Yeah, and it's kind of good from a psychological level too, because you can look at it and realize, no, it's not every day, but it feels the way it does. So it can kind of help to look back and see that you are making progress.
That's a really, really great tip, Billie. And, you know, journaling in general, there's lots of research that shows how helpful it is to people who have a chronic disease or an acute injury. That's a really good tip. You know, also, we have a number of resources. on our website, and we'll put those at the end here about how to talk to your doctor about your joint pain. There are specific words to use. There are specific questions to ask that actually help your doctor understand better what it is you're going through, so that what we try to do, as you know, Billie, at Arthritis Consumer Experts, is get people prepared to best have that conversation, to give them the best questions. Doctors actually more highly regard patients who come in who are well prepared. So if you feel you can't do that for yourself, bring someone with you into your visit to help you do that. But how do you stay positive? How do you look forward?
I think just looking, if looking back at how far I've come, and knowing that there are solutions out there.
Yeah.
Um, Actually, earlier I was wearing my sweatshirt that the woman who I heard about my surgeon from, she made these sweatshirts, and they say "vouloir c'est le pouvoir," which means where there's a will, there's a way.
Oh, I love it.
So yeah, where there's a will, there's a way. Just because one person, tells you no, doesn't mean that you aren't right.
We cannot thank you enough for sharing your time, your energy, and your expertise as a person living with osteoarthritis, living with a hip replacement, and all of that, living successfully. So we appreciate you very, very much. We wish you a very happy 2021, and I can't wait to ride a bike with you again.
Me too.
Okay. Thank you, everyone, for joining. See you next time.